Soft tissue sarcomas (STS) in teenagers and young adults (DYA) are a subset of cancers that can be particularly challenging due to their biological characteristics, the unique needs of younger patients, and the impact of the disease on their development and lifestyle. Here's an overview focusing on soft tissue sarcomas in this age group, including types, symptoms, diagnosis, treatment, and supportive care considerations. Types of soft tissue sarcomas in teenagers and young adults. While many types of soft tissue sarcomas can occur in teenagers and young adults, some are more prevalent in this age group. Rhabdomyosarcoma. More common in children and adolescents. This cancer arises from skeletal muscle and can occur in various locations, including the head, neck, urinary tract, and limbs. Osteosarcoma. Though primarily a bone cancer, it can have soft tissue components. It typically occurs in adolescents and young adults and most commonly affects the long bones of the arms and legs. Synovial sarcoma often affects young adults and is commonly found near joints, especially in the arms and legs. Liposarcoma. Rare in teenagers but can occur, particularly in young adults. It arises from fat cells and can develop in various soft tissue locations. Fibrosarcoma. This type can occur in the young adult population and usually arises in the limbs or trunk. Symptoms. The symptoms of soft tissue sarcomas in teenagers and young adults may include lumps or swellings, a noticeable mass or swelling that may be painless initially, growing over time. Pain may develop as the tumor grows, particularly if it compresses nearby structures or nerves. Functional limitations. Depending on the tumor's location, there may be limitations in movement or function, e.g., difficulty walking or using an arm. Systemic symptoms. In some cases, symptoms such as fatigue, unexplained weight loss, or fever may occur, particularly if the cancer has spread. Diagnosis. Diagnosing soft tissue sarcomas typically involves medical history and physical examination. The healthcare provider will assess symptoms and examine any lumps or swelling. Imaging studies, tests such as MRI, CT scans, and ultrasounds are used to visualize the tumor and assess its size and location. Biopsy. The definitive diagnosis is made through a biopsy, which may involve needle aspiration, incisional, or excisional methods to obtain a tissue sample for microscopic examination. Staging. Additional tests may be conducted to determine the cancer stage, which informs treatment decisions. Treatment options for soft tissue sarcomas in teenagers and young adults typically include surgery. The primary treatment involves surgical removal of the tumor with clear margins to reduce the risk of recurrence. In some cases, limb-sparing surgery may be possible. Radiation therapy. Radiation may be used pre-operatively to shrink the tumor or post-operatively to eliminate remaining cancer cells for high-grade or larger tumors. Chemotherapy. While the effectiveness of chemotherapy varies by sarcoma type, it is commonly used for rhabdomyosarcoma and in some cases of synovial sarcoma. It can be administered before neoadjuvant or after adjuvant surgery. Targeted therapy. Some soft tissue sarcomas may respond to targeted therapies based on specific genetic mutations or alterations. Supportive care and considerations. Psychosocial support. The diagnosis and treatment of cancer can significantly impact the emotional and mental health of teenagers and young adults. Support from psychologists, social workers, and support groups is essential. Fertility preservation. Some treatments, especially chemotherapy and radiation, can affect fertility. Discussing fertility preservation options with healthcare providers before starting treatment is crucial for young adults. Education and career impact. Support is needed to help navigate educational and career plans during and after treatment. Accommodations for absences and academic support may be necessary. Long-term follow-up. Survivors of soft tissue sarcomas require regular follow-up care to monitor for recurrence and manage long-term side effects of treatment. Prognosis. The prognosis for soft tissue sarcomas in teenagers and young adults can vary based on several factors, including type of sarcoma. Some types have better outcomes than others. Tumor size and grade. Larger and high-grade tumors generally have a poorer prognosis. Stage at diagnosis. Early-stage tumors that have not spread have a better outlook than advanced-stage tumors. Conclusion. Soft tissue sarcomas in teenagers and young adults represent a unique challenge that requires a comprehensive approach to diagnosis and treatment. With appropriate care and support, many young patients can achieve positive outcomes and return to their normal lives after treatment. Ongoing research and advancements in treatment are improving the prognosis and quality of life for these patients. If you or someone you know is affected by this condition, it is essential to work closely with a healthcare team experienced in treating soft tissue sarcomas.